So welcome to the CDMS Virtual Tumor Board. Before we get started, I wanted to introduce myself as well as Dr. Brittany Barber, who will be joining the call. Either she's on already or will be joining shortly. We are the chair and co-chair of the Curriculum Development and Maintenance Service at the AHNS. And we've recently taken over this service from Mike Moore, who's just done a phenomenal job over the last several years. But we wanted to highlight four resources that are available to you guys and kind of what the basic expectation is around the use of these resources, because otherwise you might be lost as to what the goal and what the role of those resources are. The four resources are a standardized curriculum, the monthly virtual tumor boards, a textbook called Essential Cases in Head and Neck Oncology, and assessment questions through Dosed Daily. Those are the four resources. Okay, so I'll go through each of them in some detail. The standardized fellowship curriculum is something that we've developed over the last 7 to 8 years. It includes a very high level list of things you should know how to do surgically during a fellowship, and also knowledge areas around oncology and reconstruction in each of the chapters. The best part of the chapters, which are extremely short, we're talking about 1 to 3 pages long for any given topic, is that at the end of it is a very short reading list of papers that if you've probably never encountered, you probably will not be as good an oncologist and reconstructive surgeon, okay? And obviously the primary role of your fellowship is to make you an oncologist, and in many fellowships, reconstruction is a very, very important high second goal, okay? So please use that. It's on the website, and also we'll be sending it out to you, and also we're constantly updating it. So the reading list is being updated. So things around sentinel lymph node biopsy for oral cavity cancer, updates in robotic surgery, the role of neoadjuvant therapy, like it's not outdated. Like we have those items in the curriculum and they're constantly being updated. Okay, that's item number one. Item number two is the virtual tumor boards, which you guys are, oh, by the way, the standardized curriculum, our expectation is that you go through at least 60% of the assigned sections. A good way of doing that is as you're making a presentation or as you're about to do a case, for instance, an oral cavity case, you look through the chapter, go through some readings. If you're doing a tracheal resection, look through the trachea chapter. If you have a very difficult ethical situation in your fellowship, go through the ethics chapter, okay? The second thing is the monthly virtual tumor boards. Again, the expectation is to attend about 60% of these. Now, you may not always be able to attend them, especially East Coast and West Coast. They're always Wednesdays at 7 p.m. Eastern Standard Time, once a month. They are recorded. So if you miss them or you simply can't attend them, look at them online. These are extremely powerful sessions. They usually involve 3 faculty members with 3 of your co-fellows from across the country or across North America that will be presenting 3 cases. You will then have 2 expert discussants. These are rather senior, very experienced individuals who will add commentary to each case. I find personally, I learn every time I attend a virtual tumor board. I would strongly recommend you attend these. They're some of my favorite sessions. Wonderful. Number 3, there's a textbook. It's called Essential Cases in Head and Neck Oncology. It's about $100 to $120. It can be purchased on Wiley. This textbook was developed by the AHNS. It's a problem-based textbook. It follows the same format as the curriculum. The chapters are based on topics: oral cavity, larynx, ethics, basic science, tracheal resection cases, parapharyngeal space tumors, paragangliomas, you name it, it's in there. And it has some cases with some questions and answers included with excellent references. Our recommendation is that everyone purchase this textbook. Some programs are purchasing it for their residents. Many university libraries have the textbook available as well. So feel free to purchase that. It's an excellent resource and it was developed by CDMS. Last but not least is we send you guys daily multiple choice questions to answer. These are through Dosed Daily. Our expectation is that you will go through at least 70% of these. They're really easy to do. You get a little email, you click the answer, you'll get some feedback on your answer choice almost immediately. I think between that, the virtual tumor boards, and the standardized curriculum, if you're reading around your cases, you will be a very strong surgical oncologist. Unlike other surgical oncology training programs, we don't have training programs with like 5 to 7 fellows where these types of curriculum can be delivered at each center. So it's really important for us, especially as we go through accreditation and other things, to ensure that you guys are receiving the knowledge you need to be good oncologists and reconstructive surgeons. Okay. That's the last thing I had to say. I want to hand it off. There's quite a few people to thank for this session. So the topic for this particular virtual tumor board, other than the introduction I provided, is job search discussion from the AHNS Young Member Service. Our moderator and the person who organized all of this is Dr. Karen Choi. Thank you so much, Dr. Choi. Dr. Andreas Burr is the AHNS Young Member Service Chair as well and has been involved. We have 3 excellent presenters. We have Dr. Alex Keshner from MUSC. We have Deborah Shi from Barrow Neurological Institute, and we have Dr. Melina Winden from the University of Kentucky. So I'm going to hand it over now to Karen to take over. Thank you guys so much.
Okay, great. Thank you, Tony, so much, and thanks for joining while on vacation. Can you see my screen? It's showing.
Yep,
okay, perfect.
we can see it.
Yeah.
So I'm really excited about this panel because it's something that I wish I had when I was a fellow. So I think it's really great that the CDMS and AHNS is doing it now. We have a really great group of surgeons that we kind of range anywhere between early to mid-career, and we have a broad range of what our practice types are and kind of what our career development has been kind of evolving in. So I'm really looking forward to this panel to kind of share our experiences and insights we've gained on these topics, navigating fellowship, how to develop your career early on, and really what to look for while you're kind of thinking about your first quote unquote real job. Okay, now let me make sure I'm doing okay. So we do have a set of questions that we'll kind of go through, but I do want to make this extremely informal. So if you guys have questions that pop up, things that you want to ask, please feel free to unmute, raise your hand, or put it in the chat. I have the chat open here, so I'll try and be good about monitoring that. So please interrupt as needed. Use this time for yourself to kind of explore questions. All right, so, okay, our first panelist that I'm going to introduce is Alex Keshner. She is currently an associate professor at MUSC, did her medical school at University of Michigan and residency at UAB. She then did her head and neck fellowship at UPenn and finished in 2015. After that, she had her first job was at Yale, where she was there for 2 years, and then she transitioned to the University of Kentucky, where she was there for 5 years, and now is at MUSC, where she's been, I think, for the last 3 years. Is that right? Yeah. Okay, great. So her practice is a combination of both ablative and reconstructive head and neck surgery. She also does some advanced style endoscopy. She has a history of some industry-sponsored research as well as an interest in clinical trial research and is actually currently enrolled in the clinical trialist training program at MUSC. Melina Winden is an assistant professor at the University of Kentucky. She did her medical school at University of Connecticut and then residency at Johns Hopkins. And then she did her head and neck fellowship at UMich in 2023. Her practice is also a combination of ablative and reconstructive head and neck surgery in a head and neck oncology only practice. But she is also a surgeon scientist and has internal K funding for her research, which focuses on health services and survivorship. And then we have Debbie Shia, who is a head and neck surgeon in private practice at Barrow Neurological Institute. She did her medical school at Vanderbilt and then residency at Johns Hopkins, followed by a head and neck fellowship at Indiana in 2024. And her practice encompasses both ablative and reconstructive surgery, as well as facial nerve reanimation. And then lastly, I'm Karen Choi. I'm an associate professor at MD Anderson, did my medical school at University at Buffalo, residency at Monty Medical Center, Albert Einstein in the Bronx. I did my fellowship at MD Anderson in 2018. And then afterwards, I was at Penn State for 5 years before transitioning back to MD Anderson, where I've now been for the last 2 years. So my practice is an ablative only practice with a focus on oral cavity, torics, and skin. And I also have an interest in clinical trial research and am involved in clinical operations. So I just wanted to share quickly some insights because I know it's August, so it seems really early to be thinking about jobs because you just started fellowship. But I do think it's really important that this is happening now and that you're starting to think about these things, especially as you explore your career interests and goals throughout the year. And so I just wanted to share some results from this mixed method exploratory analysis study that we did through the Young Member Service. We were really interested in learning more about what challenges early career surgeons had while looking for jobs, and what were some of the things that they felt helped them prepare for early career and transition to independent practice. And so, with regards to finding a job, the majority of people, as you can see, use multiple methods to kind of search for a job. And this included a variety of different components, mostly word of mouth and networking through conferences. But there was also a fair amount of cold emails being sent and kind of scouring through job postings. Um, as far as feeling prepared for practice, the vast majority of our respondents felt that they were very prepared for independent practice after fellowship. And I think that's truly a testament to the quality of training that you're going to get this year. And as far as what they felt really helped them prepare most for independent practice, this included having adequate case volume as well as broad exposure to head and neck cases. But it also included having adequate outpatient clinic exposure with your attending. So I just want you to keep that in mind as you go through the year, because I know it's really easy to want to focus all your time in the OR, but keep in mind that kind of going through that decision-making process, workup of patients, how to handle difficult conversations, things like that. This is all exposure that you're going to have now, and with experienced people before you kind of get thrown out into the world and have to do it on your own. So without further ado, we'll go ahead to the Q&A portion of this panel. So our first question for our panelists is, what was most important to you in your first job search? And this can be geography, family situation, the type of practice, research, all sorts of things. So I guess we'll start with Alex.
Well, thank you, Karen. Thank you, Tony. Thanks everybody for letting me come hang out with you today. Really exciting and very excited for all the fellows and the really fun journey you're going to go on. I'm a cautious optimist. And so I thought everything was going to be great and wonderful, and that I was going to finish up fellowship and the amazing job was going to pop up into my lap and it was going to be amazing. And so I made the mistake of marrying a guy going into a GI fellowship. Just kidding. He's wonderful and I absolutely adore him. But we were trying to get in a place where I could be nearby. So geography was super important. And so when you're doing that, it's definitely hard because we are a small specialty. We go to a meeting, you know everybody who's there. So we were trying to get into the New York area. And at the time, there were really no jobs. So the closest I could get was Connecticut. And if anyone knows their East Coast geography, that's not really close at all. It's 20 miles, but it's 2 hours in real life. So that was really the most important part. But it's one of those things that you really have to take into consideration, like what's actually available too. So you can be a cautious optimist or a cautious pessimist, one of the two. But that's something to keep in mind. But that was the first one for me.
Thanks, Melina.
So actually very similar to Alex. First of all, thank you so much for having me on. It's an honor to be on this panel. And for all the fellows listening, I know you're probably all exhausted after your flaps. And so thank you for listening in to this important topic. I also kind of wish that I had this. So I think the most important thing to me, similarly with Alex, was geography. So my partner is in the humanities, and so had landed a tenure track job that he actually commuted by plane to keep during my fellowship year. And so it's very hard to land a tenure track job with the humanities. And so, I wanted to be an academic head and neck surgeon. I am a surgeon scientist at this point. However, that wasn't the most important thing to me. I kind of I'm happy that I chose that path, but I was kind of willing to take less dedicated research time at that point just to have the geography work out. And so I literally pulled up Google Maps and learned a lot about the Midwest and looked for opportunities, and I'm really glad that I found one that fits really well at UK.
Thanks, Debbie.
Good to see everybody. Thanks so much for having me on. I was lucky in the sense that I did not have any geographic ties or specific areas that I was shooting for. So for me, the most important part was finding like a clinical practice that I was going to be happy with. So I really wanted to do high volume, high acuity, complex cases. And so I had pretty much cast a really wide net for academic, private practice, private academic places, and was really happy with where I ended up because it's everything that I wanted.
Awesome, thanks. I think one of the pieces of advice I had when I was looking for jobs from one of my mentors was that when you're looking at jobs, there's kind of three things that you want to think about. One is geography, one is the type of job it is, and one is money. And if you can you have to think about what's important to you of those three. And if you can get two out of the three in your first job, that's fantastic. So for me, I was kind of thinking more along the lines of similar to Debbie. I was thinking more about like what kind of job I wanted to get. Being an ablative only surgeon, of course, my options are a bit more limited from what departments are looking for because I knew I wanted to be in academics. But it was important to me to kind of just cast my net widely and just kind of see what departments were open to an ablative, a busy clinical ablative surgeon. And that's kind of how I ended up at Penn State. Okay, so we will move on to the next question, which is which resources were most helpful in finding jobs that were of interest? So I guess we'll maybe go backwards and start with Debbie this time.
For me, it was pretty much all word of mouth. I did send some cold emails at places that were like geographically more appealing, but those ended up not working out because they weren't hiring. And so, since I wasn't really tied to those places geographically, the cold emailing not working out didn't end up being a huge game changer for me. So it was purely like all word of mouth and everything that my fellowship attendings heard about and emails they got, they all forwarded on to me, and that's how I found my job and all the interviews that I went on, pretty much.
Melina?
So I would definitely say word of mouth is really important, and for that reason, I'd encourage you all to make time to go to national meetings this year, and to kind of go to the social events, every social event that you can, and kind of talk to new people, be a little bit of an extrovert, even if that's not your natural state, and you'll get a lot of information that way. I think that's how a lot of people do find their jobs. Cold emails did create some opportunities for me. At first, they were no's, and then they turned into maybes and yeses. So I did have some luck with that. I was fairly persistent slash annoying, maybe in that department. Fellowship directors will have the insider scoop. I would actually encourage you all to make sure that you're having proactive conversations with your fellowship directors. Everyone's busy, and you just don't want to have these conversations too late. And their part of their job is really to help you kind of transition to the next phase. And it also looks good for them, right? If you land a job that you're happy with. And so I would just start those conversations early, make sure you have some dedicated time, even maybe to sit down and kind of discuss what you're looking for in a job. The other thing I would say is, and I don't know that any of you will find job, but for those of you that are looking maybe at private jobs, you can work with recruiters, but also Google job alerts is actually pretty good and comprehensive. You can see if any jobs are posted in a certain geographic area.
Yeah, I would say one of the best things that you can do is one, sign up for committees as well. Shameless plug for history section of AHNS. It's wonderful, as also as Recon is. But a lot of times things are not posted until later. And so one good thing is to have a network of people. And like Melina mentioned, sometimes it feels a little bit gross being like, I want you to take me as your person. But people knowing that you're there, that you are interested, especially if there's a geographic component or if there is a certain practice that you're really interested in. So word of mouth was probably the most effective for all three of my jobs. So it really does make a difference. And talking with people, you actually will oftentimes hear when someone's maybe starting to talk about retirement and things like that. With regards to private practice jobs, I did actually interview for a few in the first go round. And so just be careful with the physician recruiters because sometimes they'll overload you with information because as soon as they hear that you are interested, sometimes you'll get a little bit much. So drawing some boundaries with them early on is also a good thing. Like, please only contact me during this time. And then finally, you can make things happen. So if there's an interest in a certain place and you have a certain skill set, one of the things that with the cold emails is saying, hey, I've noticed that you are missing, silendoscopy as part of your head and neck group. I'm someone who does that. I could add that to your specialty group, or I'm very interested in a certain type of research. And that's where those cold mail emails can really help to sort of highlight what makes you the next person that they might want to add, even if they weren't thinking about adding it. Academics can be pretty tight on money, so that's not always necessarily an option. But kind of figuring out what are the skill sets, like Liam Neeson style, like I have a special skill set to be able to offer to your potential coworkers and things like that.
Yeah, and I echo what the other panelists are saying about just getting your name out there and being visible at Academy, AHNS. These are great ways to kind of have your name be recognizable. Because, there might not always be an immediate job available, but if they know who you are, they know that you have a specific interest in something or a specific need to be in a certain geography, more often than not, your name will come up. So sign up for committees, get involved with the different sections or services, volunteer for projects through the HNS. Like this is the best way really to kind of get your name out there and start your kind of networking. I will say that word of mouth being the most used method of finding a job is also the most frustrating part of finding a job because sometimes, especially if you're at a smaller fellowship program, you might feel like you don't have the same access to, the what's going on the ground. So getting involved with the HNS is really a great way to kind of bypass that obstacle. Okay, how was your experience with job interviews? So I forget who was talking about. Debbie, were you the one talking about your job interviews? Maybe you want to start.
Sure. Yeah, I had a blast with all my job interviews. I think that was the time when you get to go and really see like what is the practice like, what are your potential future coworkers like. And I think for me, especially since I was looking at a lot of like private practice and private jobs, like what are the support systems that exist already to help support the practice of a head and neck surgeon. I think doing free flaps not in an academic center like without residents can be tricky. And so understanding like what kind of mid-level support is there. Are you the one that's responsible for rounding every single day, or do you have help from NPs or PAs? Like, what's your clinic look like? What kind of resources do you have? And those are all times where you can really see it. And of course, like, those are questions that can get answered over the phone, but seeing how the teams work and what's lacking and what you are going to need to build from the ground up for your job. I think that was really evident on all the job interviews that I went on.
Yeah. For Alex or Melina, were you guys expected to give job talks, or was the interview like across multiple days, multiple visits? Did you ever meet with any of these folks at like conferences, things like that?
Oh yeah, for a few of the ones that I interviewed, they had me give like a grand rounds to sort of highlight sort of what my practice would look like and my background, that kind of thing. Got to meet with a lot of people, and and Debbie, you have so much more foresight than I did when I came out of fellowship. I was completely naive and very, very optimistic, and thought that every single head and neck practice had all of the things that my fellowship and residency had. So I asked none of those questions. So if you can rewind this presentation and all of the things that Debbie said, write those down and then check on those when you're doing yours, because you come out, you're like, I'm going to operate 3 days a week. I'm going to have 2 days of clinic. I'm going to have a half day of academic time. And that really isn't necessarily really what happens in real life. Like, oh, well, you get one block day of this amount of time. You get, one nurse for this part of your day. So I had no idea to ask about any of those things. And they were just like, here's our new building. Here is our nice dental chair. Here's our other things. And so depending on who's taking you around for the interviews, I met with a lot of like practice managers that I didn't know which questions to ask, and they didn't know which information to give to me. So coming in with Debbie's questions, I think is huge. Do it. And then, there were certain ones that were very polished that really had they had a little thing set up, like this is where you fit in as a head and neck surgeon. This is what your job would be. So I think knowing what you want out of it, and then looking at what your fellowship people are doing. So if you see someone's practice and you're like, man, Karen's practice is dope, I want to be just like that, figure out how that happened. How did she get, an MA and then, a nurse that are with her only, and she's got a scribe, let's say. I don't know if I'm building your practice out of the more that you want, but, which things really make her day and her life be the job that you want to have. And so I did not ask any of those questions. That I would say the interviews were great. People are super nice. I like talking to people. Clearly, there are some things that are very important to find out.
Melina?
Yeah, so I had a great time on the interview trail. It was really fun. It's the first time you get to go out. I guess fellowship interviews are a little bit like this as well, but they in general would be very happy to have you. I mean, people enjoy meeting other people that do the same thing, and so I really enjoyed it. I think that the most important meeting that you have most likely during that time is going to be with a chair if it's an academic practice, right? And so you would want to definitely come into that meeting and with a clear expectation of like the information that you want to get, and don't be afraid to kind of ask those questions. So if there's anything confusing about the salary structure, it can be hard. Like we're not used to asking those questions, and so I would just encourage you all to find a way to just make sure you leave that meeting with the information that you need to make a decision. Because it's hard to call and ask clarifying questions about the salary later. It's a little bit easier to do that face to face, is what I found, at least easier for me. Even if it's a job that you're not super interested in, if you can go into the experience and make sure that you get a good amount of information so that you can compare it to your other job offers, I think that's also really important. And so, yeah, I think I totally agree with kind of looking at how the practice is set up and what support that you'll get. I mean, one thing I remember asking was who puts in orders like in clinic. Is that a me job, or is that do I have help with that? Just because it takes a lot of time to do a lot of the administrative work to get a patient actually to the operating room for head and neck surgery. And so understanding like how many nurses you might be working with in the clinic space, how many MAs is really important. Do you have resident coverage every day? Is there protected time for resident education that might fall into certain times, like your flop day? Not that happened, but these are important things to kind of ask about, and it'll give you an idea of what could be a really big deal after you get to practice, and hopefully not a surprise.
And I will throw another thing into that, the part about like what is the actual job. So especially for places, if you're cold calling them and they don't have really a job for you and you're trying to fit into some other rubric that they have, try to pin down what that actually is, because sometimes it gets invented on the fly. So that's another good question to ask, kind of like what is the actual job?
Yeah, I think that's important because one of the things I was going to say is that especially if you're looking at more of like an academic job rather than a private practice job, there might not be a lot of flexibility with salary and things like that. And so that might just be something that it is what it is, and the chair can't really, there's not much to negotiate from that perspective. But there are other components of the job that could be actually negotiable. So if you're somebody that's interested in research, the amount of protected research time you have, that could be something that potentially might be negotiable with the chair. And you shouldn't be afraid to ask what that possibility is. If you don't ask, you'll never know. Or things like, if you're interested in like education and teaching, asking about what opportunities there are with the medical school or the surgical, ACGME training and things like that. So think about those kinds of things. Like, what are the stuff that interests me beyond just like what my clinical practice is, which is, of course, still very important. All right. We'll move on to the next question, which is, how did you ultimately choose your first job? So I know Alex and Melina kind of spoke to this a little bit as far as kind of geography being an important component to it. Debbie, did you want to talk about kind of what led to your decisions of choosing private practice?
Sure, yeah. So I guess I can start just by first describing like what my job looks like in the group that I'm with. So Barrow Neurological Institute originally was like very well known and kind of has their base in neurosurgery. And so there's a group of like 32 private practice neurosurgeons that we work with, and they essentially built up this huge institution. And 5 years ago, like during COVID, they were like, oh, it would be pretty smart to have some otolaryngologists with us to do all these like crazy school-based cases. So they hired first a rhinologist and a neurotologist 5 years ago. And the rhinologist also does ablative head and neck surgery. And this surgeon convinced two of the plastic surgeons that worked at the hospital to do all of his recon for him. So for 2 years, there were these two plastic surgeons doing all the head and neck recon. And neither of them had like done an extensive amount of head and neck flaps in their training. So it was kind of like reinventing the wheel and doing head and neck free flaps the way that otolaryngologists did perhaps 30 years ago. And so 3 years ago, they hired their first ENT head and neck free flap surgeon. And then so this ENT surgeon was doing like I think 100 and 150 flaps on their own every year with the assistance of these plastic surgeons. So then they were looking for someone else to join, and that's how I got this job. But for me, ultimately, it ended up choosing this job required a lot of being like very honest with myself. And part of that was a little painful and like coming to terms with what really those important things were when it came to finding my job. So I'd always thought that I wanted to stay in academia. I always thought I wanted to be in like, doing research and like involved in resident education, med student education. And then ultimately, when it came down to looking at the job opportunities that I had and like the experiences I had as a senior resident, as a fellow, realized that I was going to be a lot happier at a place where I didn't have residents and getting to do that on my own. And of course, there are pros and cons to each. And there are certainly times where I wish that I had residents because I'm the one that gets called in the middle of the night when, something goes awry and when there's a transfer that needs to come, like, or an odontogenic abscess, like getting my case interrupted for things like that. Those are all things that I have to do where as that's not necessarily the case for people who stay in academia. But ultimately ended up being a lot of like soul searching and being really painfully honest with yourself about what are the things that are going to be the most important to you and what's going to bring you the most joy. So even though I had like, told myself over all of residency that I liked research and I wanted to do these things, in reality, that wasn't going to be the thing that brought me the most joy in practice. And we're lucky enough that we have some affiliations with local medical students, so I still get to work with med students, but we don't have residents. There are neurosurgery and general surgery residents that I get to interact with, but we don't have ENT residents. So those are all kind of things that ended up playing into my decision to take this job.
Awesome, thanks. Alex and Melina, did you want to speak more to this question?
Sure. I actually realized I didn't talk as much so far about the research portion of this. So ultimately, I was trying to choose, excuse me, between two surgeon scientist positions. And I remember this time in my life extremely clearly because I was actually in Spain trying to decide between these two positions. And I was talking to everyone I could talk to about this, about my life problems and how I was having trouble deciding, specifically because one of them I was going to have to make my husband commute pretty far for that. So anyway, I actually ended up going out to dinner by myself and making a very long list because we are all very smart people with complex thinking, but I think that writing things out very clearly in categories can be very clarifying. So I actually have it here. So I'm not going to read you the whole list, but I have a list of like 25 factors that are important. And then I kind of wrote about one versus the other and which one had the advantage. But a couple I'll talk about specifically were the two that really helped me make my decision. The first was the research institutional framework and mentorship. So UK has a really good cancer center. It's NCI designated. And there are a lot of people within the cancer center that are very interested in doing the type of research that I do. And so when I went to interview, I had 2 days of meetings with people throughout the cancer center, and every conversation I had was enjoyable. It was collaborative. It was stimulating. There's a lot of people at UK that are very interested in health delivery research and specifically providing better care for the people of Kentucky. And it's a state with a lot of rural people. And so I was interested in kind of looking at head and neck cancer care delivery in that setting. The other thing that I think was really important was that UK really, really wanted me to be there. And so I think that matters because it's not like I'm asking another institution essentially to create a job for me and have it not match. Because if an institution really wants you, then you're in a position where you can make the job what you want it to be. And after you arrive, you can sort of continue to ask for things. And so I really feel like that has been true specifically with like research funding and things like that. And I knew that, if any of you are interested in doing a certain scientist pathway, if you don't have a K award in hand when you go to your first job, which many people don't, after you arrive at your first job, you're kind of going to be expected to be applying for one of these K awards. And so there's institutional K awards, career development awards, and then there's NIH career development awards, and then there's other private foundations. But things to ask are, how many institutional K awards are available per year? Are there people at the institution that I can see filling the mentor role for me that have the bandwidth, that are interested in mentoring? Are there multiple people that would be on my mentorship panel? They don't have to necessarily be at that institution, but have you kind of built that already? And so I think if you don't see it being tenable for you to actually get that institutional K award, then I would think twice, or maybe ask some additional questions. Let me see if there's anything else. Yeah, I think those are the two main. I won't go through the whole list.
I want to see this list, but
Same.
I will say, so there are no perfect jobs anywhere, right? Except for maybe mine's pretty close. I'm very happy. But it took me a minute to get there. And so ultimately choosing my job was sort of like a fly by the seat of my pants. I'm going to make me have a job at your place. And so a lot of the things that, I had no idea what was actually going to entail. So learn by my mistakes. And having Melina and Debbie's list in hand. So chose the job mainly on, like I said, mainly on the location. It was an academic center. They had cancer patients, and I had a cancer stick to treat them with. So it ended up being a really great learning experience. I learned a lot about myself. I learned a lot about how I wanted a practice to run. What are the things that were really instrumental? And learned that I do not like going to multiple sites because I hate driving I-95 with the passion of 1,000 suns. So, like I said, each experience that you have is another story to put in your pocket. But you can take all of our stories and use those to inform your decisions. And so, each job is going to be a little bit different, has its own quirks. But ultimately, you take away the experience from it and learn a whole lot. But yeah, mine was totally hot mess. It was great. It was wonderful, but I was not nearly as organized as I currently am 100% right now.
Awesome, thanks. I do think one thing to keep in mind for all of you guys is I feel like we go through training and we think we're gonna find this job, and it feels like such an important decision because you're like, this job is what I've been working towards, and it has to be the perfect job. It has to have all the things. And if I can't find it, if I make the wrong decision, or if I can't find the right job, like that's it, my career's over. And I think, Alex's experience perhaps is maybe some comfort that that's not true. And I think one of the things I was always told when I was looking for jobs is it's okay that your first job is not going to be your forever job. And you should actually like think of your first job as not your forever job. If you go in with that perspective, with it, what it does is it allows you to keep an open mind of what you're learning from your current job, and also what do you want from your job that maybe this job isn't getting and that you now know and are better equipped to ask for your second job. So I think for me, when I took my job, I always told myself in the back of my head, okay, I'll be here for minimum 5 years and then figure it out. And if I'm happy, I'll stay. And if there's something else, I'll, explore that option. And so that's kind of like the mindset I had. And like while I was at Penn State, I really took a lot of advantage of the opportunities I had, the clinical experience that I learned, all of that kind of stuff. I really grew a lot in that first job. And I think it did help set me up to be a lot better equipped for, the second job. So Anyway, just something else to keep in mind. Okay, so our next question is, how did you make yourself marketable for the job you wanted? So I know Alex kind of commented on this a little bit earlier with, sending cold emails and kind of being like, hey, here's a gap that your XYZ has and I can fill it. But what do you guys, Debbie, Alex, Melina, do you have any kind of additional advice of things that you can do, or that the fellows can kind of take with them as far as how they can make themselves, a more ideal candidate for a job? Maybe we can start with Melina.
So I think the biggest thing for me was, I mentioned previously, I didn't start fellowship knowing that I wanted to have a surgeon scientist position, but I realized that it opened up opportunities for me. And, I did a T32 research fellowship during residency, so 2 dedicated years of research. And so I had a strong background in that. Um, and I really enjoy research and could definitely see myself continue to be productive and to have that career. So I ended up kind of exploring that further. And I talked to a few different surgeon scientists that I had trained with in residency, to kind of understand what that pathway looks like, to really understand it, so that when I went on my job interviews, I was able to actually articulate why I might be successful at that path and why I was a good investment in that regard, because it is an investment from the department, right? It has to be part of the departmental mission. They lose a little bit of money on you, and so they don't want to cast their bets on the wrong person. So that was helpful for me. It was something that wasn't directly applicable to me was, if there are niche areas of your practice that you even had exposure to in residency, but maybe didn't do very much in fellowship, I would talk about those in the job interviews. Like if you did a bunch of RFA, thyroid nodules, we did transoral thyroid surgery at Hopkins, things like that. You can talk about those areas, even if you don't want to make that definitely part of your practice in the future. Well, I guess no, you have to have some chance of wanting to make it part of your practice in the future, but you can say that you've been specially trained in these things and kind of test the waters and see if that makes you marketable if you really want that job.
Alex, what about you?
Definitely make sure that if you advertise it, that you are willing to do it. I will say, as one of the busiest style endoscopists inadvertently that I've met, so one of the things where I was like, I can do style endoscopy if you need me to. And we actually had to build out a whole separate clinic space for that to happen. So I really do like it. I hate it and I like it and I hate it, but I also love it. But make sure that if you're offering it, they are going to jump on that. One of my first meetings with my chair at my second job, he was like, "You're doing a great job. We're so excited how you're building everything." I'm like, "Yeah." And he's like, "You're like this and that." I'm like, "Yeah, robots and like and flaps." And he's like, "And silent endoscopy." I was like, "Yes, yes." Very enjoyable. So, like I said, I do enjoy it, but if you're gonna advertise it, make sure you're willing to put the money where your mouth is. And then other marketable things too are involvement again in AHNS. I'm just gonna keep pushing that. Institutions, especially academic ones and also private ones, they love the kind of free advertising you get when you go participate in things. It really makes the institution look good. It helps with recruitment. It helps with the reputation of the institution. And so one of the things, like, I'm really involved in this, like this, that, or the other. I'm very into the recon board, or I'm very into education. And so it gives you a lot of those connections. And that's another thing that you can really highlight, like, oh, I've been in AAO since I was, 15 years old or whatever. And so those things are also very helpful. And then in addition to that, any external training, so like MBA, I know a lot of people have done Masters of Science, Masters of Public Health. Those are also things really to highlight. And then the other portion is, if you don't like research, like if you say like, I don't want to do research, make sure that you don't put that as part of your like, I do research. Because if you don't, again, if you're not wanting to do it, don't put it on the thing, because they're going to expect you to have a K or something coming in, or at least trying to apply for one. And so, one of the things that I told people when I was coming in, I was like, look, I love clinical research. I'm a workhorse. I'm very friendly. I like to teach people and I like to go to a lot of meetings and things like that. And so, some people be like, I don't like we don't want you. That is not our thing. But on the same token, there are certain parts that say like that helps you match with your job because it's kind of like a weird dating situation, but like friendship dating, I guess, in that you really want to have a nice match with it because we spend 90% of our time, with our workforce people. So marketing yourself as yourself, I think, is probably one of the best things to do.
Yeah, and I think that requires a lot of soul searching, as Debbie was saying. Like, you really want to have painful conversations with yourself, and just be honest because, no one's going to be happy if you're not being honest with yourself about what you want to do in your career. Debbie, did you want to add anything to all of this?
I don't think I have a ton to add. I'd say like finding out like there's a Venn diagram of like the skills you have and what you want to do and what the job is looking for. And like obviously the wider that overlap is, the easier it is for you to market yourself. But if there's a job that otherwise like geographically fits well, but like if there's not a huge overlap in that Venn diagram, you can still focus on the things that are there and like emphasize that during your interview and your job search. So also understanding like what is the institution trying to like look for in that job position, like what kind of holes are they trying to fill, and like marketing yourself in that like slice of the Venn diagram.
Yeah, you're really good at describing things, Debbie. I love that so much. It's a really good way of thinking about it. Okay, we have a question in the chat. So, Imadadine, I hope I said your name correctly, asked if someone decides to do another fellowship or further training in a certain skill or surgery, what can he or she do regarding that, especially if that might help in landing a job? Um, so I just want to clarify, are you asking, should would it help you find another job to do another fellowship after the head and neck fellowship? Is that what you're asking? Okay. So I think it depends on what it is that your interest is in. I think so for example, we have, I don't know if she's on, but we have a current fellow at MD Anderson who did a PEDS fellowship and then is now doing the head and neck fellowship. And particularly, I think that aligns with her interests as far as doing kind of like PEDS and head and neck. I've had other fellows that have done like a skull-based fellowship and then a head and neck fellowship because they wanted to kind of combine that. So I think it's one of those things that if you have a very specific interest with what you want to do, and you're not going to be able to develop that skill within the head and neck year, like the head and neck fellowship year that you have, then I think absolutely you should explore that. I don't know if the panelists have additional insights on that.
I would say outside of the fellowship part, one thing depending on your job. So I actually had a friend who wanted to do an MBA, and so part of her sign-on was that the institution would pay for her MBA. So that way it was a kind of considered part of the job. So she couldn't get the raise as Karen mentioned, you can't always negotiate salary, but there are other benefits that can sometimes be negotiated that sort of fulfill part of that portion. And so that is something you can always sort of test the waters with. Um, Heather Edwards has an amazing talk about negotiation. If you ever have a chance to corner her, to kind of say, like, you sort of tell them, this is the thing that I want to do and help me make it work. But yeah, I think if you want to do a second fellowship, do it. If it's only because you're like, well, I wonder if I need to just add something else, it's another year of your life where you're in training. And so that can be really challenging, especially because we already start off kind of old to begin with because of our training. So, if it's something that gives you passion, awesome, do it. And it can help depending on where you're trying to go.
Okay. We have 10 minutes left, and I think should have enough time to go through the rest of the questions. So the next one is, what do you wish you had known when you were going through your first job search? So Alex, do you want to start?
Everything that was on Debbie's list. So I wish I had know myself better. I had wished I had known how to spot things where ambiguities. So when I said, hey, I want to do free flaps, and they were like, well, you can maybe do them here. My first job, I ended up doing all my own resections and reconstructions so that I would be able to get enough flaps to maintain my practice. And it's fine and it's doable and you learn a lot. But I wish I had known that kind of going in. It was totally different than what I was expecting, knowing where your sites are, knowing what your supports are. But really, honestly, like Debbie's whole list, like that was all the things I didn't ask.
So something I wish I had known was that there is money for you if you want to do research. I did have a startup package through the department, but surgeon scientist positions are kind of weird, and there isn't a uniform rule for how they're designed. And so I think that gives a little bit of latitude for you to ask what you need, and what you need is a lot of money. So I would, make a reasonable ask. And it doesn't have to be from within the department. It can be outside, like the College of Medicine that's affiliated with the academic institution often has separate funds for this. And so you might have to do a little bit of your own sort of digging for that. I'm very well supported at this point through the department, but it took a little bit of groundwork from my current chair, who's very supportive, to kind of find that extra source of funding, which has worked out well. But I would say that definitely ask for more than you think, and I think that it's justifiable because those positions. That way you'll get some good work done, hopefully, to be able to justify some pilot data for some future grants.
Debbie, you gave us a pretty comprehensive list earlier, but do you want to add anything?
I think the only other thing I'd add for is like how to negotiate and what to even ask for. Like I had zero clue what were even things that you could negotiate for aside from like, can you pay me more money, please? Like, can you give me a larger sign-on bonus, please? And usually the answer to that is no. And I had like no idea what else to even ask for. So sort of like, research funding, like Melina talked about, other things that you can ask for and negotiate for, knowing that they're probably not going to say yes to everything, but things that I ended up asking for was like an ultrasound machine in clinic, like specific staff dedicated to you, like other infrastructure things that if the practice isn't already set up for. And then the one thing that I didn't even think to ask for, but it happened to like fall upon my lap to ask for it, was paid parental leave. And that's another thing that like, if you look at like any other country, that's like a given, but a lot of times it's like not included. And so the job that I took originally, the parental leave policy was like, oh, you use your vacation and then you just don't get paid. So there was a plastic surgeon that worked in the group that took 4 months off after her baby without getting paid at all. And I was like, wait, that's ridiculous. So that was ended up on the list of things that I had negotiated for. So that's one thing that I wish I was more prepared for.
Yeah, and I think other small things that you don't necessarily think about are like, I asked for a headlight for the OR, and I asked for a camera so I could take medical photo documentation, like little things like that you don't really think about. You might as well ask. Like, think about what are the things I would want in a practice that would help me, do what I want to do. And then just kind of ask for it and see. Because those are little things that your chair may have control over. Less so like, salary and infrastructure and other big things like that. But anyway, just some other thoughts.
And I will say, yeah, a lot of times there's like a package that happens when we get hired. So at one point we talked about doing a panel called How to Save $1 Million because they spend $1 million every time they hire one of us. As Melina mentioned, they lose money when they hire us. But one of the things that often happens is there are capital purchases that happen with the hiring of a new surgeon. So they were like, oh, do you want some new micro instruments? I was like, no, these are fine. And idiot, like, yes, I would like the new micro instruments. Like, it's already part of it. I want the shiny, colorful, iridescent ones that are really pretty. But so the worst they can say is no. No one's you're already, once you've gotten the job, they're not gonna be like, oh, she asked for micro instruments. They're just gonna be like, no, we can't do that this time or whatever. If you want a new fancy microscope, talk to the people that you're joining because they might be like, hey, we really want a new microscope. And that's another thing that can really be helpful. Or, hey, we're trying to get a PA. Can you see if we can ask for that? Because then that gets kind of built into the package. So, we're so used to just saying like, yes, whatever you want. I'm in fellowship. I'll do the thing that you asked me to do. And really, just sort of imagine that you're just like a businessman walking into a thing and asking for whatever you want. That's how you have to think about it a little bit. Because like I said, no one's going to punish you for asking, as far as I know.
Yeah. And it is a shift in your mindset. Like Alex said, we're used to just being told what to do and just accepting the fate of whatever it is, because that's what's been beaten into us. But you are on the upper hand. Like you are the one that's providing them with what they need. So you have the power to ask for these things. And if they say no, they say no. And that's fine. At least you asked. Okay, so how did you make the most out of your fellowship once you decided on a job? So I think this is a really important question. to kind of talk through. So, Debbie, do you want to start?
Yeah, I think figuring out what parts of your job you don't feel as comfortable with. So one of the things that ended up in that Venn diagram for me, where the job wanted was someone to do who did facial nerve and facial reanimation. And so I was lucky enough to get a little bit of that in residency, but definitely was not up to speed to be doing it myself independently without a lot of hand holding. So the last couple of months of fellowship, I tried to spend some extra time with the facial plastics team where I did fellowship. And then I also actually went back to spend some time with one of my residency mentors as well to get some extra time and like better understanding of like clinical decision making and operative decision making to because I knew that was going to be something that was a part of my practice because when you work with 30 neurosurgeons there's going to be a few faces that don't work so it ended up being like a pretty significant part of my practice even though it's not something I was prepared for like necessarily was looking for at the beginning.
Something that I found really useful at that time was actually taking a step back during some of the more challenging flap cases and watching my fellowship assistant fellowship director raise a flap. Like I just kind of wanted to watch a little bit to see how he was so efficient, and I think that was really helpful because at that point you know all the steps, you know you can do it. But I wanted to see what instruments he used to kind of do the case safely from start to finish. So that I found really helpful and useful. And the second thing that I found really useful at that point was understanding what instruments I liked, micro instruments I liked, and what tenotomies I liked, and then asking for the cat numbers for all the instruments, just so again, so that could be a capital expense when I went to my new job.
Get the codes. Get all of the codes from all of your mentors on how they code their cases. I had no idea what I was doing. And so they had like a quick coding thing where like someone came and talked to us. They're like, here's a new patient visit. And I'm like, yeah, it was really complicated, I guess. So all your codes. The other thing is sit in on the VSPs if you don't, the virtual surgical planning. And that's from the resection side and from the flap side, because it's really funny. I participated in a lot of them mainly as the reconstructive surgeon in the past. And then when it was time for me to be the resecting surgeon, I was like, well, just cut the tumor out. So being able to tell the engineer where to make the cuts, how to make it safely, how to make it accessible when you're putting the guides on. And then another one, and this was specific to my first job, was that I needed to learn how to do micro by myself. So I had my mentor show me how do you do micro when you don't have an assistant. And so it was really helpful actually because he pulled out a double Ackland, which I had never seen once during any of my training. And I was like, where have you been hiding this little magical tool that I have never heard of? And so then I wrote down that catalog number. But then, yeah, and then also knowing what things your hospital has available. So, for instance, one of my fellows can only use virtual surgical planning in some parts. And so, kind of being able to also do non-virtual surgical planning and knowing how to do the popsicle sticks or the rulers or whatever to be able to do your bony recon. And then also knowing which reps are helpful to you. So a rep can be a really good friend, not just because they buy you candy sometimes, but also because you know their product and they'll be able to kind of help you navigate. Oh, like, oh, I have a guy in that city. I'll introduce you. They can help you kind of make sure you get all the stuff that you need. So it's like all these little weird things that you don't think about because you're like, you just show up and the plate's there and it's beautiful and it's already shaped and perfect. And I learned a lot of things like for one of my resecting models, I didn't realize that we put the cutting slot in a way that you could not actually put a saw in, so I had to take it off afterwards. And I was like, oh, the engineer didn't catch it. I didn't catch it. So all these little quirks and things like that. So I like to talk about my issues aloud so that my fellows can learn. So, I think one thing that we can do as panelists also is be like, hey, by the way, this is something that I have done in the past or am currently doing that don't do it.
Yeah, definitely agree. I mean, for sure, start hunting down and collecting your attendings preference cards because the most head and neck trays are going to be similar, but some, different institutions are going to collect different things. So keep an eye out if there's an instrument you really like or there's something weird that always shows up in this particular case. Make note of that because when you go to your other institution, you can then ask for it or take a picture of it. So you can be like, this is what I want. How can we get it? The other thing is I would go through and like steal all the dot phrases
Nothing.
for like the
Just
way
like
you for the way you
exact
um,
description.
you know, counsel patients on things like the risks of things or your surgical dot phrases, all that kind of stuff that you like take for granted, take all of that. Um, and then a more serious note, what I started to do it was pay attention actually to the way my attendings positioned patients on the table because oftentimes you take it for granted how a patient's positioned or how they're draped and you don't think about it because it's such a like minor part of the surgery. But I learned the hard way that if you don't position a patient correctly or if it's not draped properly, you are going to struggle hard in that case, and all your like confidence of your surgical skills and things that got you there is going to go down the drain. So like take pictures away of the way they set things up or how they position themselves or where they make the incision, why they make the incision, where they do, all of that kind of stuff. Start paying attention to those little things that you don't necessarily always pay attention to. And then the last point I want to make is another call out for spending time in clinic, because I think that was one of the things I learned so much in clinic with my attendings. To this day, the way that I share difficult news, bad news, the way I share complications, all of these little soft skills, I do them now because I saw how my attendings did it in fellowship. And just like the conversations of like, wow, that was a really weird patient. I don't understand what is going on. And like you go through the imaging and you're just like talking through it with the attending. But it's a really useful experience because then like, in a year or two, when you also have a very weird patient, you're gonna be like, wait, I saw this once in fellowship. So I think spending a lot of time in clinic is going to be really, really valuable for you all.
And
Okay.
100%
Oh
of the
yeah,
time,
sorry, go ahead.
I say, well, 100% of the time, your first week in clinic, you'll have something that you've never ever seen before. And then you'll call your mentors and they'll be like, I've never ever seen that before. So it's okay. It happens.
Yeah, for sure. And to this day, I'm still like, that's weird. I don't get it.
That
Um,
happens even in the first year, I would say that it just kind of keeps happening.
yeah. So yeah, so we are at time. I don't want to take everybody else's time, but yeah, I think we'll wrap it up here. Thank you again to Tony and Brittany for allowing us to kind of jibber jabber all for this last hour. And for all of the fellows, I hope you got some valuable pearls and things. And please feel free to reach out to any of us if you do have additional questions that you wanted to ask. Thanks,
A
guys.
special thanks to Karen and all the panelists. Thank you guys so much. That was incredible. I think this was maybe one of the best attended tumor boards at 50 people. People left the OR for this, which says a lot. Good luck on your job search. Reach out for more help. Next tumor board will be in about a month's time. It'll be on a Wednesday from 7 to 8 p.m. You'll receive an email about it. And we're looking forward to seeing you all then.
Awesome. Thanks, everybody.
Take care. Bye-bye.
Bye.